So the name of the test is the 5-time sit to stand. The purpose of the test is to measure the functional lower extremity strength, transitional movements, balance, and falls risk. This test is important for patients with neurological dysfunction since they may have decreased balance, sensation, strength, and will be at an increased falls risk. This test has a cutoff score. The cutoff score is 15 seconds. Less than 15 seconds is normal. Greater than 15 seconds indicates an increased falls risk.
So the equipment that you'll need for the 5-time sit to stand is a stopwatch and a chair, preferably without the arms, about 16 inches high off the ground, and a gait belt depending on the population that you're dealing with. A few things to keep in mind while performing the test as a therapist is you start the timer as soon as you say go, not when the patient moves. You want them to come to a full standing position every time they stand up, and when they sit back down, you don't want their back to hit the backrest. So now I'm going to just give you some different instructions that you have to specifically say to the patient right before the test, and then we'll get into the performance. So the instructions for the patient are, I want you to please stand up as quickly as you can 5 times without stopping. Keep your arms folded across your chest the entire time. So when you stand up, I want you to fully stand up. When you sit down, you can sit down so your butt hits the chair, but make sure your back doesn't hit the backrest. And then I'm going to be timing you with this stopwatch, and I want you to begin when I say go. Go. 1, 2, 3, 4, 5. Good. The time was 9:28, and that's important because you have to be able to document that time, the speed that the patient was performing the 5-time sit to stand, and the assistance level that they needed throughout the test.